Mr. Chairman, thank you so much for having this hearing. It really is such an important topic, and I was able to listen to much of the first panel from my office between meetings. It really was good, and I appreciate it. Secretary Shulkin, thank you for being here. Thank you for your testimony, and thank you for saying in your testimony this is a #1 priority, because it is. But I do remain deeply troubled by the IG's findings from May 2017 that VA is not complying with a number of policies, including 18% of facilities not meeting the requirement for 5 outreach activities each month, 11% of high-risk patients' medical records did not have a suicide prevention safety plan, and for 20% of inpatients and 10% of outpatients, no documentation the patient was provided a copy of the safety plan. There were several shortcomings in the use of patient record flags, coordination of care for patients at high risk of suicide, and critical improvements to follow up for high-risk patients after discharge. 16% of non-clinical employees did not receive suicide prevention training, and more than 45% of clinicians did not complete suicide risk management training in their first 90 days. So when it comes to suicide prevention policy, to me, anything less than 100% isn't acceptable. So when will all of the IG's recommendations be fully implemented?
Well, so first of all, this is exactly why the IG is valuable, pointing this out. I have no other mechanism to get data that comprehensive. So we have committed to addressing the IG concerns. The reason why we've made suicide prevention the #1 priority and made all of our leadership this month sign off on the declaration is to fix those issues. We've committed to training. So over this year, look, 100% is the right goal, but I can't tell you exactly what date we're going to reach that, but we're going to be working really hard to get as close to that as possible, as quickly as possible.
Well, as Senator Moran alluded to at the Veteran Suicide hearing at the VA Appropriations Committee back in April, I asked for monthly updates. And until all of the problems at the crisis line are resolved, VA has not done that, and that is really unacceptable. So I want a commitment from you today to all of us that we will get those updates starting right now.
I think you have that commitment, yes.
Okay, well, we will intend to see that happen. Let me ask about women veterans. This is something I've asked about many times. I am really disturbed by the increase in suicide rate among our women veterans. Between 2001 and 14, the rate of suicide for women veterans who do not use VA care increased by 98%. Now, I've heard from women veterans many times about how they don't think of themselves as veterans, and I hear far too often from women who don't feel welcome at our VA facilities, just don't feel like that's their place. It is a significant problem, actually, that the RAND Corporation testified in April as well. But this increase in suicide is the most important reason yet that I believe VA has to redouble its efforts to reach out to women and get them into care. So I wanted to ask you, what are we doing to address that?
Well, you gave a really important statistic, which is that those that over the last 15 years, between 2001 and 2014, those women that did not receive care in the VA, that the rate of suicide went up by an extraordinary number. You said 98%. Those that did use the VA, we actually saw a decrease in suicide rates over that 15-year period of 2.6%. So we know that particularly in this population, but it's for all veterans, getting care and access to care makes a difference and saves lives. The issue about making the VA more welcoming to women is a critical issue. It's a cultural issue. And we have worked hard to create women's centers and to change the culture and environment. I speak about this, so does our Center for Women's Veterans all the time. But of course, we are absolutely, as this is our #1 priority, committed to doing much more and to be more aggressive and to put more resources into this.
Okay, well, this is something we have to keep working on, because if a woman doesn't consider herself as a veteran, she doesn't think about going to the VA. If she is not welcome at the VA or doesn't feel that the veteran facility is welcoming to her, she won't go. If she has other issues, childcare, work, it's doubly hard. This is not an easy problem to solve, but we really have to put hearts, minds, resources, and as a country really recognize women veterans.
I agree.
So I feel very strongly about that. I just have a couple seconds left. I want to, if I can, just ask about the VA's Reach Vet initiative, to use predictive models to identify veterans who may be at risk of suicide before it happens. And I wanted just, if you could quickly tell us how that model works, but also 14 of the 20 veterans who die each day by suicide do not come to the VA for care. So again, I want to ask, how does that work for folks who are not coming to the VA?
All right, so very quickly, ReachDet is a big data analytic research project that when I was undersecretary, I said it's time to stop researching it and start putting it into practice. Senator Tester's point about every day we delay, there's going to be more deaths. So we have moved it into the clinical setting. Our suicide prevention coordinators get lists of veterans' names that are in the highest 0.1% risk of suicide, 80 times higher risk than a person who's not on the list. And they proactively are calling out every day saying, how are you doing? How can we potentially help you in anything that you need help with, and connecting with them? And I meet with those people. Dr. Carroll has more contact, of course, and it's making a difference. I don't have statistics.
Are you working with local groups and providers and non-VA agencies to use the program?
No, we do not have that data. ReachVet data, because of its limitation, uses VA user data off of our electronic medical records. We have no way of identifying the 14 in the community. That's a big issue for us.
Yeah.
I think expanding VA access in mental health will save lives. That's why I made the decision on other than honorable discharges to do that. So we have a big hole here. One of the big holes is with the Department of Defense. What we're working with now with them, and they're being very cooperative, is essentially an auto-enrollment program. So nobody leaves active service without knowing where they can get their mental health care. I think that's going to be a big deal in eliminating a gap right now that we have.
Okay, thank you very much. Appreciate it.